And I don't want to use, since the word's been already used as in pandemic, and we know of the urgency. We are not focusing on the urgency that we have of mental health. Like if you look at those small little meteors that we're having, we know that there's a lot of dogs that have been adopted over this time. I've read the statistics and talked to some people. We know there's a lot of people who has
Like if you
adopted
look at those small
pets
little
and things like that.
meteors that we're having, we know that.
And so we know that mental health is a huge priority for us, and yet we are in a sickly issue right now. How can someone see the signs that they need to raise their hand and say, I need help?
So I always try and approach mental health and the idea of when to ask for help from a perspective of balance. From that moment where you feel like something's off, even if you can't articulate it, that's the moment where you want to start seeking help. A lot of times there's a crisis response perspective of mental health where something has to be really wrong before I reach for help. And please, if you're at that point, yes, please still reach for help. We want to help. But the most optimal time to reach out for help is when you feel like something is off, you're not sleeping well, you find that you can't concentrate like you used to, the things that used to bring you joy aren't anymore, you're losing yourself in conversations. Any of these little things, any of these little things are indications that maybe there's something on my mind that it would be helpful to talk through or to work through.
Yeah, and I think mental health, so many symptoms are relative because everybody has a different psychological makeup, different personality profile. So a change in behavior is kind of what I tell clients to look for. So for some people, going to bed at 2 a.m. is normal. Great, that's your routine. But if you're suddenly not able to sleep and you're going to bed really late, that's something to look at and take seriously. So it's really a change in your behavior. If you're noticing, your appetite's really reduced, or you're really agitated more than you usually are, or as Emily said, your concentration's really off. It's kind of like a change in your behavior. And I think, again, it's kind of helping to normalize reaching out. So reaching out for support is sometimes viewed as weak, especially like with males. There's a huge stigma in the male population with just mental health and mental wellness and anything related to your psychological makeup. It's viewed as somehow an indication of being weak or flawed
Right.
if you reach out. And I always thought that was interesting, and it's really a barrier, especially for a lot of men. It can be a barrier for people of color. Just that idea of seeking help. And I always give the analogy, if you break your arm, you're not embarrassed to go to the doctor to
But
get
the
a
one,
cast put on.
but the one thing about the arm, Miss Kelsey, Dr. Kelsey, is that I can see that it's broken.
Exactly. And I think that's the basis, perhaps part of the basis of the stigma is that, okay, I can see you're physically ill, you're injured in some way, but with mental health, sometimes it's a little less obvious. But even when it is obvious, even when the person is even looking at like themselves, people often say, oh, you don't look like yourself. Even then, it can be hard for someone to go reach out and get help, even when it's visible. But yeah, I do think that is part of it. For some people, it's not something that's clearly apparent, readily apparent. So there's sadly a shame around it that really I try to combat. It's I think a huge barrier for a lot of people.
And with that, I think,
Go ahead, Dr. Only. I was going to say,
with that, I think that even within the Black female population, there's this idea of being a strong Black woman. And what that means is I don't need anybody. I don't need help. I'm independent. I'm this, and that. And I think that is also a barrier that we find in the Black community where people don't reach out for help. And it's looked at as a weakness when you reach out because you're supposed to be the strong Black woman.
so now let's look at those two pieces. And I agree with the whole body connection, and that's just what I do. But let's look at what a male has. It has a stigma. And a female also has a certain stigma. And now seems like we're in the beginning of the fight of our future as Black people in this community. We've always been fighting for something, but now I think someone's hearing us. Maybe they're forced to hear us. And yet we're traumatized by individual environments we have come from, individual experiences we had heard of, and individual personalities that we are having trouble with anyway. And we're not getting help. No one's saying there's all these red flags, right, all over the place, and we're here to let people know that whether you think you are or not, I'm going to tell you right now, voice it out there. You are traumatized, and you do need to seek professional help. That's just important to me for us to build as a community, for us to build as an individual. Even if you go in, more people go in and get their cars checked out than they get their human lives checked out. If they went into the clinical setting and saw Dr. Kelsey and saw Dr. Oni and say, hey, can you just check me out? You're like, absolutely. Sit down. Let's look up under this hood. And then you can go from there. What do you guys think about that idea? Just like, come on in. Let's check you out. If you don't need to be here, we'll send you on your merry way and give you a little bit of a tune up, and then off you go.
Yeah, like a bit of a maintenance check.
Yeah.
Yeah, no, I agree. And that's actually the practice in so many other fields. Your car, dentistry. You go to the dentist, you don't go just to get your tooth extracted. You go for a cleanup, right? You just go to make sure everything is,
right,
going okay. Yeah, and I do think that should be the practice in mental health. One of the things that is tricky is how do we get people to see that as well, right? And there has been like an increase in what's it called, wellness coach or life coaches. So lots of people become life coaches, and I think for whatever reason, people sometimes are more comfortable. Okay, I'm going to go see my life coach. I'm going to go talk to somebody who's not a psychiatrist or psychologist. So I think there's a little bit more openness when it comes to professionals of other, basically professionals under other labels.
okay.
Maybe even you notice this in some of your holistic practices. People are more comfortable talking to you if you don't necessarily have that title, basically. And even in barbershops, there was like, that's a huge industry where there's informal therapy done. And there was actually an article about that one of my former professors sent about how there's been a decrease in informal therapy that's been happening since coronavirus, because barbershops are closed, hair salons are closed, nail salons are closed. So all these places that people would go for informal therapy are now closed, and people aren't getting that one-on-one sense of connection, talking things out. So I thought that was interesting.
I always thought that it would be a great idea for therapies to open up hair places. Like it was like, I'm here to do your hair, but believe it or not, I'm also here for you.
Yeah, Dr. Afia Mbilaka, she actually coined the term psychotherapy. Yeah,
Nice.
it's really the intersection of therapy and hair. It's really interesting. She was a professor at Howard. She's now at UBC. So yeah, that's her whole thing. She loves that stuff.
That's lovely. Now, I wanted to comment on the idea of mental health check-ins, or, looking at it as like a maintenance thing. And I think it's a really good idea. I do think that one challenge is accessibility and not really knowing how to navigate or find a therapist or find a clinician that you're comfortable with to go in and do those check-ins with. But having the general idea that I'm just going to go and do this regularly is a really great structure to have in mind. But before we can even get to that, I think it's important to keep in mind that self-awareness is a really big part of you even being aware that something is going on in order for you to then go and seek help. So just regularly having some kind of check-in with yourself, I think, is really important practice to incorporate in your daily practice.
The self-awareness, I really believe is tough because, when you practice your meditation or you practice any different healing modalities, it allows you to look at yourself closely and say, how am I? And when we look, and I was writing an article about what we ask ourselves when we're young, like, who am I? Right? We may ask that at a young age. Who am I? Like, what am I supposed to be? And what am I supposed to do? And we have these maybe ideas that we look at, maybe if we have a great parent or a father or a mother, like, oh, I want to be like this, or some type of, what's the word I'm looking for? Hero, that they look at like a Superman. I'm a Batman fan, but anyone like that, they're like, well, what am I? But no one ever asks themselves, how am I?
Mm.
I don't think people know how to ask that question. And I think if we can get anything across right now is how am I? And then write those answers down, you would see that it's not introspective. It has more to do with what you thought people need to look at you as a strong black man, or as a strong black woman, or as a strong person without feeling weak. So it's not so much what people look at you as what you think you want people to look at. And if those answers are highlighted, you realize that you're not okay.
Mm-hmm. Yeah, that's such an. I think a lot of people don't even have like the emotional vocabulary to describe how they're feeling. Like I remember a few years ago coming across that feelings wheel, and it's basically a color. Yeah, Oni, you probably have seen this millions of times. Basically, a colored wheel, and there's maybe 20 or 30 words, and it's like, okay, do you feel sad? And then it breaks out sad into like disappointed, unsettled. It like breaks it, like fine tunes your emotional language, and I think that's a really, really good tool. Just to be able to describe how you're doing, because a lot of times you know you feel off, but you don't know you don't know how to describe it, so you just say, I'm fine, I'm good, just to move on. So you're not really addressing it because you don't know how to describe it. So sometimes just something as simple as having a feelings wheel. You can put it on your phone, you can download it to your computer, just so like throughout the day you can check it with yourself. And there's like a list of words to pick from to describe kind of how you're doing, to check in.
Definitely. And I think with that, the reason why I always encourage individuals to seek out a licensed professional counselor instead of the informal counseling is because there's psychoeducation that's happening when a person is licensed. They have a certain set of skills and training where they can help you to develop a language where you can better understand your emotional experience and then communicate it to another. The informal counseling is great. I think it's better than nothing, but it doesn't necessarily help you with increasing your vocabulary, with increasing your skill set as far as coping skills and things like that. And so again, informal is great, but I always encourage people to go and see that licensed counselor, because then they can get these skills in this language that's really necessary for you to understand it and then also to communicate it to other people.
Mm-hmm.
Do you think, I wonder with people who are life coaches, and I know some life coaches, and then I also have the life coach thing, and I have no problem with saying you need to see someone. Do you think the other life coaches would say that or do say that?
I hope so.
I hope so.
That's like someone coming to me for a medical thing and I'm trying to treat them. Like I don't have medical knowledge. So I'm hoping that's what's happening. I can't speak for life coaches out there. If you're practicing outside of your scope, and that goes for any field, you should always refer to the appropriate specialist. Even if you think you might have some, tools or suggestions to help with the person, definitely, let them know, direct them to somebody who can kind of specialize their recommendation and their treatment.
One of the, I know we mentioned it on a soft note about people take care of their cars more than anything. And I have to say, if you check on an inanimate object more than you check on yourself, that should say something. That should be an alarm anyway.
Right.
Yeah, it should be.
Absolutely.
I mean, do you think there's a way that we can inform people, even in this live thing with the Dr. Only and Dr. Kelsey, and doing this and saying, if you do this, this is your light bulb. It's almost like the comedian Jeff Foxworthy. There's your sign. Well, there is a sign out there that it's blinking, and you're not checking in.
Mm-hmm. So, like, what would that sign be?
Yeah. What do you think would that sign be?
I mean, that sign. I feel like the sign is different for everyone. And I feel like sometimes by the time the sign's blinking, it's a little late, right? Like by the time that sign's going off, like as we know in a car, to bring it back to the car analogy, that little gas tank light, it goes off before you're on E.
Right.
Like if it blinked only when you were on E, that would be a problem. So I think it's like helping people to just become aware of the subtle shifts in their behavior and their emotions, because that's kind of the time where you should check in with yourself. And if your solutions and your coping mechanisms aren't working, maybe reach out to a professional. So it's less kind of a response to a crisis situation and more of a daily check-in. I think that could help people.
And I think also it comes down to a value question. And this is also a cultural piece too, where a lot of times we're not taught to value ourselves.
Yeah.
We're taught to value money. We're taught to value material things. You're definitely taught to value your car, especially if it's a luxury car. But at one point, do you make the decision to value yourself above material things? And I think that, again, those shifts in consciousness and thought processes is what a professional can ask you those questions that you may not think to ask yourself, because you might not be thinking about how it might be a reflection of you not feeling valued in society. And so you haven't learned to value yourself. And so you don't check in with yourself. Or you might feel like your role as a mother is to value your children over yourself. So that's what you put your value on. So, but again, there can be a lot of things that are playing into why you don't think to look and do what you need to do for yourself versus others, and definitely for material things.
If I asked, if the question comes out, do you value yourself? And a person gets put off by that and says, what do you mean? Gets very hostile. Is that a trigger of a sign that they should recognize that maybe they should go see someone?
If you ask someone, do you value yourself? And they say, what do you mean?
No, do you value yourself? Not even devalue. Do you value yourself? And they come off, they get very pushed off, and we're like, what do you like? They come off as in, of course I do, or very. I think there's the sign right there. Like, how dare you ask me if I value myself? And whoa, because it's not a hostile question. It is probably the most loving question that someone could ask you. Do you value yourself? And it there is no room for what do you mean? I mean, it's pretty clear. Do you value yourself?
Mm-hmm. But the sad part is, for a lot of people, they don't know what that means. And I think that what a counselor can do is operationalize that question. So one thing I ask my clients is, what have you done for yourself today? And it's not necessarily as direct as, do you value yourself? And then it's the defensiveness of, what do you mean? Because I can, to answer your original question, I do think that that's a sign that you need to see someone. That's in my opinion. But one of the things that a counselor can do is kind of soften those types of questions by asking you more pointed, specific questions. And then after I ask you a series of, what have you done for yourself? When's the last time that you just took a day for yourself? What's the last thing you bought for yourself? How do you talk to yourself? What are you telling yourself? So as I ask you these questions, then my last question is, well, given all this information you've given me, do you think you value yourself? But it kind of softens that reality, because that defensiveness lets you know that on an unconscious level, they're having some kind of conflict, but they're not aware of it. So it's important to meet a client where they are.
Mm-hmm. Yeah, I think that's what defensiveness is showing you in any context. So that you're kind of touching on some sort of trigger point for that person. Right. It could be related to valuing yourself or whatnot. And also like asking, what have you done for yourself? And that touches on like self-care, which is, I think, a really important thing right now and always, for people to do things that are part of their self-care routine. And I think a lot of times we get like, there's some sort of social prize for being busy, and in ways like running yourself into the ground and not having free time, like being like, oh, I'm too busy to do that. And we feel, I think a lot of people view that as like a stamp of honor, a badge of honor, but it's really important to just take care of yourself, check in with yourself. It's all part of valuing yourself in general.
I think one of the things that we know that we talked about, right, these things are not taught. And that's why I do in these forums, mental health forums, mental questions, or this conversation, or the panel I have, or the panels I will have, is the conversation that we need to talk more on mental health than anything else. Because if your mind's not right, there is no way you will be able to be physically healthy, spiritually healthy, or anything healthy that's anything resembles if you're not emotionally, mentally right. And we're not talking about once you get right, I'm good and let me fly. We're talking about maintaining the balance of understanding who you are. What do you say to that, Dr. Only?
Absolutely, I completely agree, and I love the clarification you made about that right term, because it's not a question of are you perfect, is every day a happy day.
Right.
Life is still going to continue to happen, but it is about that balance. How are you managing things that are happening, and how do you feel at the end of the day? Do you feel worn out every day? Do you feel like, yeah, I had some challenges, but I could see where I could, I did well, I could see where I could improve? So definitely.
Mm-hmm. Yeah, and mental wellness is it's not about never having a negative emotion. It's
Right.
like
Right.
just because you're like how we were in Miami, happy all the time, that's not necessarily indicative of mental health and mental wellness. It's basically being able to handle negative emotions in a healthy manner, being able to handle challenges and setbacks and obstacles in a healthy manner, taking care of yourself. So it's kind of the whole gamut that kind of, I think, comprises mental wellness.
I feel guilty of this because I think memes are killing us. And I write memes to help people. My type of things I write, I hope people ask themselves the question, right? Like just recently, I wrote about a little thing in the picture. I said the hardest thing you could ever face is facing yourself, right? If someone just goes, what do you think Dr. Paul meant by that? I want you to ask yourself the question. But I think sometimes memes has depleted or watered down that if I put out a good meme, I'm pretty good.
Yeah. And I think even just kind of watered down some of the terms. So like there was a time where the triggered memes were all over, like this triggered and that triggered. And it's like, so when I'm in therapy and I'm talking about trauma and like real triggers, then it's like, oh, I saw a meme that said da 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 da. And it's like, it's a kind of a deflection.
Right.
So I can also see it having that type of impact too, where people just kind of laugh it off, or they have a moment but don't really go deep into it. And it's like, oh, okay, yep, saw the meme, ask myself a question, now I can move on. But like you also made the point about why you do it is because it does raise awareness and it does at least bring these questions to the forefront, which is helpful. But recognizing that that's not where you stop, that's just the beginning, is going to be the next step.
Mm-hmm. Agreed. I have such a interesting relationship with like memes and social media. I feel like I was very late to the game with social media and Instagram and all this like technical lingo. But yeah, no, I agree. I think memes have a role in kind of bringing up difficult topics. It's kind of like a safe way to introduce something to people. But yeah, it does take going a little bit beyond the meme, kind of a discussion starter, if you will.
That's you thinking, no, and I think if you are a thinking person, and it sounds insulting, but if you don't dig into yourself, I don't know how I'm worried.
Mm-hmm. And I think that that's how a lot of people give their power away, is that they are so aware of how everything outside of them is impacting them. This person is doing that person's not doing this, and then it's making me feel this way, without recognizing that you do have more control over your emotional experience than you may be aware of. When you do things like, I always recommend culturally responsive cognitive behavioral therapy, then you come to understand how what you're thinking is directly impacting your behavior, and that's directly impacting your emotions and your emotional experience. And so when you go through I love CBT because it's short term. It's about 6 to 12 sessions. It's also, it's time limited, it's efficient. And then there's a big psychoeducation piece. But what it really helps you do is point that arrow back into you, because we all taught you can't change anybody else, you can only change yourself. And I think that phrase has been taken for granted because we haven't stopped to really look at where our power lies, which is within us. We can't change what they do or don't do, but we can change how we respond to it.
Absolutely. And CBT, there's so many different, types of therapy and schools of thought about like how therapy should be conducted. But yes, CBT is what I specialize in. When I was, going through my training, you can treat surprisingly a lot of different conditions because there is that. It's coming from the framework of like, what can you do?
Right.
Yes, sometimes you'll need to do some psychodynamic therapy to talk about like why you have certain thoughts and early childhood experiences. But when it comes down to actionable items, what can I do to change how I'm feeling, how I'm thinking, how I'm behaving? CBT is that's literally the premise of CBT, and that's what I think I love about it. What a lot of therapists like about it, CBT.
And I think also because it's solution focused. So it's very present focused. What can we do now? Where's your power? And how do we execute it?
And I think right now, because of COVID-19 and people are doing a lot of virtual sessions, people are there is an air of like desperation right now when people contact, I know through our telehealth company, when people come in for supportive counseling, it's kind of like, what can I do? This crisis is happening. The therapy needs to be solution focused. They're not interested in dishing out a lot of money for multiple sessions. CBT is quick. You can often come up with a treatment plan in just a couple sessions. You can see results in a couple sessions. So I think it can be very effective just for when you kind of need a solution. You need a solution to problems. Sorry, that's an ambulance going by.
That's okay. So I hope someone's okay. That's kind of like every time I think about an ambulance, hope someone gets okay, and I hope someone gets to the hospital okay. So, now, Dr. Kelsey, you're at 5 Medicine. Where are you at? How can people reach you? We're going to get that, and then we'll also get to you, Dr. Only.
Yeah. So 5 Medicine, as I said at the beginning, it's a telehealth company. It was started in 2018. We have medical, mental health providers, yoga instructors, meditation teachers, and of course we're expanding. So hopefully bringing on some physical therapists and dermatologists for specialized treatment, specialized care. But right now we're treating acute care needs, any urgent care needs, flu, allergies, constipation, and of course mental health issues. And we kind of operate under a supportive counseling model, I guess, because as I said, a lot of people right now are coming in for kind of that crisis intervention. They just need to talk for a couple sessions. They need some solution-focused treatment plans. And everything is done virtually. So we can e-prescribe people medications. They can pick it up at their pharmacy. They don't need to see anybody face to face.
Right.
And a lot of conditions, medical conditions especially, they can be handled just by telling the person your symptoms. So yeah, you can reach us at 5medicine.com. So FIVE medicine.com. And it's really easy. You just book an appointment and yeah, you see a provider virtually.
And Dr. Only, how can people reach you if they want to get in contact with you? Even though we're going to do more of this, but
definitely. So currently I have a small private practice. I'm not accepting new clients right now, but you can always email me and see if I am at a future date. You can email me at my first name, onyi.anukem@gmail.com. So that's oni.anukem@gmail.com. And I'm also available to do any kind of talks or to do presentations. I specialize in people of color and their mental health, and then also on immigrants and veterans. So any of those populations I can definitely work with.
I do want to push up. I want to say thank you guys for coming on, and we're going to do more of this, do as much as we can, because in this time, we are trauma ridden. We are being traumatized by our own emotional experiences, by our environmental experiences, our personal thoughts, and it doesn't matter. And I know as a Black community, I know we're very, very traumatized. But as a community as a whole, as people as a whole, we have not been taught how to be well together. And there's pieces that are missing. And I think those pieces is one, getting help with your therapist and seeing a professional, and then you can get into the stream of being part of a group that is wanting to be well. Because I think if we look at this as a relationship, we're in a very bad relationship with each other.
Mm-hmm. Absolutely. Yeah. I agree. Every every person of color in the country right now absolutely is experiencing some degree of trauma. And I always just think about my personal experience. Like I I came to this country at 18, so I'm already traumatized just in the few decades I've been alive and in this country. So I can't imagine having grown up in this country from birth all the way into your 30s and 40s and 50s. It's extremely exhausting is the word that I have for it. It's very exhausting dealing with the day-to-day struggle of being a Black person in this country, being a person of color. It can also go down to being a woman, being a transgender person, somebody who's LGBTQ.
Yeah.
It kind of extends, so it can be exhausting. And I think not just for people of color, any marginalized group reaching out for help is just critical, and taking care of your mental wellness is essential.
Absolutely.
Well, let's hold on here for a second. And I want to say thank you, ladies, for joining and being part of the show. And we will do this again next time. I will text you guys later. And you guys have a safe and blessed evening. And I will pray us out. Dear Heavenly Father, thank you for bringing us together. And I hope that people hear our words when we say seek medical and mental help. Get to the professionals so you are able to be blessed and so you can move on to strengthen others. And Heavenly Father, we pray in Jesus' name. Amen.
Amen.
You ladies have a good night and thank you so much. And I will see you guys again later. Bye.
Thank you.
Bye-bye.